Okay. Here we go.
Here we go. Here we go. First one. First one, take one. Take one home with you. Take it or leave it.
Yeah. Welcome, everybody, to the inaugural recording of our Kyndl Health podcast.
Kyndl Health podcast. And, this was recommended to us by our good friend, Nico, that we do a podcast because we have chemistry. And just so you guys know, my name's Tanner Tollett. This is Kelly Berger. We are married, different last names, because she's a doctor and hardworking professional. I'm a doctor as well. And we started Kyndl Health. Tell us about Kyndl Health. How did it start? It was. I think it was your passion that kind of started it all, I think.
It was my passion. It was both of ours, I would say, though.
Different angles. With different angles.
Yeah, that's true. So we both started out in medicine as hospitalists, which is a fairly new kind of section of medicine. I'm internal medicine trained. Tanner's family practice trained. Mm-hmm. And both of us work in a hospital. So I like to just kind of call myself primary care for the hospital. So because primary care outpatient doctors don't go to see their patients in the hospital like they used to, you need essentially primary care doctor for when you get admitted to the hospital. So that's what we've been doing.
When you get super sick.
Right. When you're sick enough to need to be admitted to the hospital, we take care of you. We call consultants and we, bring in any consulting docs that need to
specialists,
be specialists. Thanks, that was the word I was looking for.
Yeah, and so this is all really new to us. The clinic thing, the clinic side, the lower acuity, not even just low acuity, but like elective, right? Optimization, like not just your normal, but like we want you to be better than normal, and that's the complete opposite end of that spectrum, right? We're going from you're almost dead. to
very sick,
You're very sick, almost dead, to now our patients are these like healthy folks that are like training for stuff, triathlons and jiu-jitsu and all these other things, and they're like, I want to get better, I want my recovery times to be better, and it's different for us, isn't it?
Yeah, but not just that population of people, also just people who are saying, hey, like I want to get better, hey, I want to feel better, you don't have to be an athlete or anything like that, but people who are just seeking healthy medicine rather than just the sick medicine.
Yeah. That's kind of what we're trying to get out of, right? Sick medicine.
Right.
Yeah.
Well, I think that in our journey of sick medicine, we kind of realized like, there's so much that can be done preventatively that the current healthcare system doesn't really do. We're so much in this sick care model that we kind of want to go into a preventative healthy care model, I mean, I've had just several instances where, I got an old lady who was admitted for confusion and a urinary tract infection, and something as simple as a little bit of vaginal estrogen could really help prevent some of these things. Or the poor old person who has just gotten so weak with muscle atrophy that they fell and broke their hip and they can't get up.
Yeah.
And, it's not their fault. It's like the healthcare system's fault, and kind of just, again, I feel like lack of preventative medicine in a certain regard.
Yeah, I like, and not to get too far, into it, but it's almost hard to say there's any fault to be had. It's really,
that's a good point.
It's a big system, unwieldy by any one person. I mean, it's kind of this just confluence of stuff that's all kind of come together. And there are major drivers of it for sure, big pharma and all these other things, private equity and stuff. But there's nobody at the helm pulling driving the big machine, it's driving itself. And so, and talking about coming out of hospital medicine into something like this, where we are learning all this for this first time, and we're our own experimental patients, right? We're doing it ourselves. So I'd say we're the first patients of Kyndl, I would say. Right?
Yep.
That's kind of where I was saying this is your passion project, right?
Yes.
You've always wanted to have a move out of the sick care model, out of the hospital, preventative health, keep people healthy.
Yeah.
I feel like when you married me, I became your project. I mean, that was me. That's me, right? Like, remember when we met and you came over to my house the first time, and there's like a line of McDonald's bags by the trash,
sitting on top of the picca boxes.
Yeah, sitting on top of the pizza boxes that I probably cooked in the plastic. You know, just threw the whole thing in the microwave. And, you know.
Yep.
And look how far I've come.
Yeah.
Right.
Yep.
So I would say that's my angle on wanting to do this, is that, like, when I noticed, I've got the symptoms of low testosterone for sure. Like, and regardless of the cause, if it's decades of not eating clean or, you know, whatever, you know, being in my 40s, who knows? But I knew that I didn't feel right at all, and something had to change. And so on my own, I'm looking into HRTs. I'm getting targeted ads by Instagram. Instagram had my ticket, right? They knew how I was feeling, getting these targeted ads for HRT, and I really wanted to try it. I think you were a little skeptical at first.
I was. I mean, this was probably 3 years ago.
Yeah.
I was just like, I don't know. Yeah. This can be dangerous.
Yeah.
Then you talked to your PCP, and he said, definitely not.
Oh, no, he said, I'll check your testosterone, but even if it's low, I'm not going to replace it.
Right.
That was his quote. Yeah. Yeah. And so, you know, well, then what's the point? Right. You know? Right. And really defeated in that regard. And the more we looked into it, it was like, it's a lot safer than it has been sold to doctors, to us.
Right.
To us. I mean, how many patients did you see in the last 10 years in the hospital that were like, this guy had a clot because he's on testosterone? I mean, a handful at least. I mean, I remember talking about a few. And it turns out that's not true.
Right.
And even just the general disillusionment of sick care model, big hospital, you know, you're staying in your rut that's dug for you, you know, and you're going to see patients this specific way. And kind of getting disillusioned with that a little bit, and being able to expand into, you know, alternative philosophies of preventative health.
Right.
And I don't, not to get too hippie. We're not, you know, not going to wave this smoking sage at you, but, you know.
Well, I mean, no. So I was going to say, we haven't really actually said, so what is Kyndl Health, right?
Yeah.
We built a clinic. We're virtual right now in Colorado. And it is a health optimization, hormone optimization clinic where we have the capabilities of checking people's labs, checking hormones, and really just kind of determining, you know, how can we make people feel better, identifying which hormones are off or not optimal, and, you know, how can we get people better optimized. I mean, it sounds like a funny word, but really you go into those, you know, the kind of, if your labs are normal on your lab report, right? And your doctor said, well, everything's normal, I'm not sure why you're still feeling like crap, right? There's a big difference between normal and optimal. And just, there's a lot of drivers in not feeling optimal anymore. There's aging, like you kind of mentioned, with the plastics and the endocrine disruptors and the chemicals in food. And there's just so much playing a role that even if you're someone who's really health conscious and working on not having plastic food containers and plastic, you know, containers for your beverages and working on those endocrine disruptors, you can still be affected by it because it's everywhere. So that's what Kyndl Health is, right? Yeah. And our journeys of just wanting to be optimal and feel better alongside with us kind of seeing, unfortunately, what happens when you're not as optimized with that sick care model. Yeah. Well, and I think that's what we're passionate about. I think that's what we really are craving in doing this
for us and for other people is that we want people to feel better.
Yeah.
We really want people to feel better. And it's been years in the hospital where, you're just looking at people crumbling and falling apart. And it's because they're fat and they're not doing all the things that we all know we're supposed to do, eating the vegetables, working out all the time, which is very hard. And especially if the driving forces to live your life, which I would say is a percentage hormones, that gets you out of bed in the morning and makes you excited to see something, to go do the thing you like. Well, guess what? You're not gonna work out. You're not gonna do anything. You're gonna be depressed. You're gonna be anxious, and
Right.
you're gonna cope with Oreos.
Right.
And that's what we've been seeing for years, and it's so hard to just keep seeing that patient and who's at the end of the road really, and saying, "Hey, you got to stop eating Oreos."
Right.
It's like, well, that's not going to do anything for that guy anymore,
Right.
And then at the same time, I don't know how much nutrition training you got in med school, but this has been a big criticism of doctors in general, is we just don't learn this in med school or residency, really, unless you're in a very specific track or program. You probably got more because you're a DO than I did.
I don't know really in medical school, but I would say that just because my honestly passion for health and wellness started in college with health and exercise science.
Yeah.
I got my nutrition training in college, really.
Yeah.
I doubt that our nutrition classes in med school were much different since you're an MD.
I am an MD. And, but you don't learn much. You don't learn, regardless, you don't learn much.
Right.
And and we all know it contributes, but at the end of the day, we all kind of look at each other and be like, yeah, too many Oreos, not enough carrots. Right. And how much have we told that to people over and over again?
Yeah, I'm guilty of it too.
And it's true. It's true. Less Oreos, more carrots. But how much can you tell a person that?
Right.
And it not work over and over again, and they don't change their, before you try something else. And maybe there's another problem here, and turns out there is.
Right. Well, and even those people, I mean, I would put myself in the category who exercises and eats healthy, and I still had that tendency toward this really just not being as healthy metabolically, right? I have PCOS, and that just leans towards elevated fasting insulin, some, slightly less better, what am I trying to say? Less glucose, metabolism.
Yeah.
That'll be an outtake.
No, we're not cutting this. We're rolling, baby.
Some insulin resistance.
Podcast number 1. Leaving it in.
No, but so even with those lifestyle changes, sometimes people just are doing everything that they can, and something it's genetic, or it's your metabolic health, or it's just something that really you still need help with.
Yeah.
And that's where some medications or quote unquote optimization really does help, right? Yeah. And so that's been part of my personal health past, is that no matter, even if I was doing everything right, I still had elevated cholesterol. I still had an elevated fasting insulin. And it's like, well, I mean, unless I literally go back to egg whites and oatmeal and broccoli, which I did do for a certain amount of time before our wedding to really lose the weight.
Oatmeal broccoli meal. That was
I know. But when I really had to lose the weight, that's what I did. But as far as lifestyle, on a day-to-day basis, like when our son hands me a Pringle, I want to be able to eat it.
For sure. For sure. I want to go back to kind of one of the things you were touching on before that, was that I think that's what we bring to the table, is that we're not just this. We're not just going to be HRT. We're not just going to be GLP-1s and all that.
Right.
Like, we're bringing all this other stuff with us, and we know where the road leads if you don't change something.
Right.
Like, we know where that goes. And we're not discounting all that stuff. I mean, my favorite new metaphor is the guys whose house is on fire. Like, don't worry about what's in the fire extinguisher. You know,
Yep.
don't worry about which one you have to use. Like, use it.
Put out the fire.
Put out the fire. Don't have your house burned down. Don't die.
Right.
And so we're not discounting Western medicine, I wouldn't say at all. You know, like there is definitely roles for all of it. If your blood pressure's high, take antihypertensives for sure.
Definitely.
Don't have a stroke. Don't have a heart attack.
Right.
But get there with multiple things. Like get
Right.
there. Add this in too. This
Right.
is fine. This is fine to add in as well.
Right.
And it's not going to fix everything for sure. And it does, you know, there are some elevated risks that are minimal, but like, okay, you know, I think we've both agreed that even if in 20 years they say if you used HRT, you live on average 1 year less. I think I'm okay with that.
I'm okay with that.
You know, because why live the second half of your life miserable,
Feeling awful.
feeling
Yeah.
terrible, just so you can live 1 more year in your 80s?
Right.
Like, I don't want to do that.
Right.
You know, so I think that's a good that's a good introduction. I think of who we are. There's clearly going to be more to this.
Yeah. I mean, I definitely want to, record a podcast on, how we met, who we are.
Yeah.
Married doctor couple.
Yeah.
We just had our 10-year anniversary.
Yeah.
I would have never, I was never someone who knew like, oh, I have to get married. I have to do this. I have to do that.
Yeah.
But gosh, looking back and just how things happen, it's wild. Life happens for a reason. That's for sure.
It does. And you find certain things and you fall into certain things and it finds you and
Right.
you end up doing, hopefully everybody's doing what they love. Right. And I think for us, what gives us real satisfaction in all this is we want people to feel better.
Yeah.
And be able to live life, whatever that looks like.
Right.
And we're tired of how can we just make your life longer? Because that's the goal of in general of medicine right now is how can we just make you live as long as possible? And we leave out the quality parts,
Right.
you know?
Right.
And so we want to get into how do we make you live more quality?
Right.
How do we live better?
How do you find yourself again?
Oh, yeah.
Find yourself again and just have the ability to wake up and feel great and feel like you want to go chase your dreams or,
Yeah.
genuinely enjoy doing something, whether it's with your spouse or your dog or your family or your kid or all by yourself
Yeah. And not feel exhausted doing it.
or super, foggy in the brain or like you're not rested or like you really just feel like sitting on the couch every day or like you need to take a nap in the afternoon.
That's when the Oreos get you. When you feel like you need a nap in the afternoon,
Oh boy.
those Oreos from the cupboard will be like, hey,
Uh-huh.
there's more Oreos in the cupboard. Yeah.
So that's really, right? We had our own personal journeys to get to where we're like, you know what?
Yep.
We want to share this with people. This is awesome.
Yep.
We want other people to wake up and be like, dang, I feel good today. And so just having the opportunity to get that going is where we're at. And we're just so excited to share our own paths and help other people get there too.
Yep. I like it. One of many, hopefully.
Yeah.
And I was kind of, just off the cuff, but I like it.
Me too.
I like what we're doing.
Yeah.
And we're going to keep doing it.
Yeah. So find us, KyndlHealth.com.
KyndlHealth.com. Link below in the details. Did I say that right?
I don't know.
Smash that like and subscribe. That's what they say.
Thanks for listening.
Thanks, guys.